Hi beautiful people, welcome back to my YouTube channel. And on today's episode I'll be telling you everything you need to know about PCOS, polycystic ovarian syndrome. Like, polycystic ovarian syndrome has become so common among the ladies of these days. A lot of women in their childbearing age, like, they're having irregular cycle, their periods are not normal, they are not ovulating well. But in this video, I'll be telling you things you need to know about this PCOS and the causes, the management, symptoms and signs. So let's dive into the video. Okay, the possible cause for this PCOS, it's not yet known. Like, it's not yet concluded that this or that is the actual cause why why women are having this PCOS, whereby their eggs are not growing well or is not growing properly. So these factors are genetics. We suspect genetics. We suspect obesity, high androgen. High androgen means is a male hormone, whereby when you as a female, you are producing male hormone. You need to check whether you are having PCOS. Like, you're not supposed to produce high androgen. It's left for the males. Okay. So you're having genetics, obesity, high androgen, stress, and all that. But these things are not yet concluded that it's the actual cause for this PCOS, for this cause of the PCOS. Okay. And remember, there are also signs and symptoms. Like, when you have these things, you need to go and check, run a pelvic run a pelvic scan to check your ovaries, your womb area, to check whether your eggs are growing properly or not. So there are signs and symptoms associated with these things. Okay, we have irregular or no periods at all. Like, you saw your period on the 27th of this month, it's coming in on the 33rd, or you saw it on the 24th, it's coming on the 29th. It is not supposed to. You as a woman, you as a lady, you know how your periods has been when you started menstruating, okay, but you know how it has always been. But now you are seeing so many changes. It is not regular, or it is not coming. Like, you have passed 2 to 3 months without any period, and you are not getting close to menopause. You need to check out for PCOS. It causes infertility, whereby you cannot be able to give birth, but it cannot completely stop you from giving birth. You just need treatments and management, and boom, you conceive. You're having loss of hair. You that know that your hair has always been full, beautiful, but now everything is going out, everything is being cut. Like, when you comb, it is coming out. Check whether you have PCOS. You are having insomnia, lack of sleep, whereby maybe by 2 to 3 a.m. you are already awake, like a security guard. You're already awake, looking at people, and like, you're wondering what is happening to you, what is going on. Check for PCOS. If you don't have any doctor, make an appointment with one. Let them examine you properly. Let them check your ovaries very well, your hormones, your estrogen and your progesterone. Check whether these two are working properly, so that you have PCOS or not. You are having acne that, like, pimples that won't just go away even after your ovulation and your period. The pimples keep staying there. They are not going. They are painful. They are icky. You're having headache. Rush to your doctor. Speak up. You might be having PCOS. So when you notice these symptoms, don't just keep quiet. Don't say it is normal. It can never be normal. You as a lady, you need to menstruate very well. You need to, your flow need to be okay, 5 to 7 days at least. Your period need to be flowing very well. Your eggs, you need to be seeing that egg white cervical mucus, or having ovulation pain. Like, you need to be noticing these things, so that you know whether you are still ovulating or not, or whether you are having PCOS, whereby it is not even growing at all. You're having cysts in your ovaries, whereby it's not growing at all. They are suddenly adding up. Everywhere. Like, you know that you don't eat too much, but you're suddenly adding up. Check whether you have PCOS. That one is among, like, it's common. It's common among PCOS patients. Adding up, weight gain, and all that. Check whether you have PCOS. Rush to your doctor. Speak to them. Let them know about your health. Let them know about you. Like, speak to them. If you have any symptom or sign that you don't understand, speak to them. Speak up. Let them understand. Like, let them know. Let them be on the know of what is happening. Don't say it is normal. It can never be normal. Okay? Yes, it can never be normal. Don't say it's normal. And also you're having fatigue, unnecessary weakness. You know that you as a woman, you're not just lazy, but you're suddenly finding you like you're always finding yourself being so weak. You want to sleep, you want to lie down, you don't have strength. Check whether you have PCOS. PCOS is very common these days. Like it's very common these days. So many women don't know. That's why we are bringing this awareness to you so that you can be able to find it out, treat yourself, get better, and move on. Okay, so there are also a management for this PCOS. Yes, there are first things. But after finding out the symptoms, there are things also to do so that you can be able to get yourself back, your period, your um ovulation, so that you can be able to you can start seeing, you can be able to notice that egg white cervical mucus that every other woman is noticing, or at least pain in your ovaries and all that. So number one management is changing your diet. A lot of women these days, they take too much of sugar. Sugar is not good for your eggs. Like you as a woman, sugar is not good for your health. Too much of sugar, not say sugar, sorry, too much of sugar is not good for your health. It affects your eggs. Like it makes them not grow very well. Or learn how to curtail your sugar intake. It is very necessary. Curtailing your sugar intake will make you, like, your body system, everything will be working normal and all that. Number two, exercising yourself. Those things that used to make you happy, do them. Be happy, stand to your feet, stand strong. Do not always feel everything is just on you. Speak to your doctor. The first treatment for this PCOS is actually speaking to your doctor. Let them examine you properly and get you diagnosed so that they will know whether you're having this PCOS or not. Changing your diet, then following the medications that they will prescribe for you. Then trying to lose a little bit weight. Weight gain is a sign of PCOS. Yes, so trying to live more on exercise, your diet, veggies and fruits. Okay, all these things will help this PCOS to go away and you get back to your normal self. Then also there are possible drugs that we give to these PCOS patients. Like you have clomiphene, metformin, letrozole, clomid, Uvamid, Uvacare. There are a lot of them out there in the market, in the pharmacy shops. But you know what? You don't just wake up and start taking these drugs. I will always say it. Don't wake up and start taking drugs just because you saw it on YouTube or anybody is telling you. Get diagnosed. Speak to a medical personnel. Let them help you get diagnosed so that they will actually know the right drugs to use for you. Okay? They'll actually know the right drugs to use on your body, giving you clomid or letrozole. Anyone that will work better, let them know. But at least let them know. At least let them be on the know. Okay? So if you have any question for me concerning this PCOS, put it down in the comment section below. I'll take them. This is just the part 1 for this PCOS, but I'll still make a video about it. Okay? So don't forget to turn on your notification bell button so that you won't miss out on any of my videos or updates. See you next time in my next video. Bye.